I'm Dr. Eman Ramzy, Assistant Professor of Chest Diseases, Faculty of Medicine, Ain Shams University. This is part 3 of our lecture, Pneumonia. Is it a case of pneumonia? Does each patient diagnosed to have pneumonia actually has pneumonia, or it may be other diagnosis? It may be actually other diagnosis. So we have several differential diagnoses of pneumonia, and we should differentiate pneumonia from other causes. Differential diagnosis of pneumonia, it may be pulmonary tuberculosis, lung cancer, acute lung abscess, pulmonary embolism and infarction, and finally non-infectious pulmonary infiltrations, as we mentioned in cases of pneumonitis or inflammation of pneumonia. What about the main lines of treatment of pneumonia? Treatment of pneumonia include the following. First, we should know the general rules for treatment of pneumonia, supportive measures for pneumonia, and treatment of complications. General rules for treatment of pneumonia. The therapy or medications should always follow confirmation of the diagnosis of pneumonia and should always be accompanied by serious efforts to identify an etiologic agent or the bacteriological pathogen or bacteriological diagnosis. But the initial selection of the antimicrobial agent is almost always made on an empirical base, combined empiric therapy, till the result of culture and sensitivity is obtained, and antibiotic may be changed accordingly after the culture and sensitivity results is obtained, and must be based on factors such as severity of infection and patient-specific risk factors. Antimicrobial therapy should begin promptly because delays in administration of antibiotics have been associated with worse outcome. The goal of treatment is to get rid of the infection with suitable antibiotics, antiviral, or antifungal agents. The specific drug used will depend on what kind of organism is causing the problem, along with host defense. But we should evaluate the severity and degree of pneumonia at first. The critical management decision is whether the patient will require hospital admission is based on the patient characteristics, comorbid illness, physical examination, and basic laboratory findings. The diagnostic standards for severe pneumonia include one or more than one of the following: altered mental status or disturbed conscious level, partial pressure of oxygen or PaO2 is less than 60 mm mercury. This means the patient is in failure. Respiratory rate more than 30 breaths per minute, so the patient is tachypneic. Blood pressure is less than 90/60 mm mercury. This means that the patient is going to be shocked, or this is a shocked patient. Or if the chest X-ray shows that there is bilateral infiltration or multi-lobar infiltration, and if the infiltration enlarged more than 50% within 48 hours of the primary X-ray. Supportive measures are generally used in the initial management of pneumonia, including bed rest, analgesics to relieve pleuritic chest pain or pleurisy, replacing any fluid if the patient is dehydrated, correction of electrolytes, oxygen therapy, excess protein, antipyretics, mucolytics, and expectorants if needed. Treatment of complications of pneumonia. The main complications which must be treated vigorously and promptly include empyema. If empyema is found or diagnosed in cases of pneumonia, there should be wide bore intercostal tube drainage as soon as possible, plus or minus intrapleural instillation of fibrinolytic and antimicrobial therapy. If pneumococcal bacteremia occurs, extrapulmonary complications such as arthritis, endocarditis must be excluded because the therapy in these cases requires higher dosage and more prolonged duration of treatment. And finally, we should treat septic shock if found. How to determine pneumonia prognosis? Prognosis is much better with early, proper, adequate antimicrobial therapy. Any of the following factors make the diagnosis less favorable and prolonged with more complications. If there is involvement of 2 or more loops, if there is underlying chronic disease, heart, lung, kidney, if there is normal temperature and white blood cell count is less than 5,000, as this means inadequate host defense against the invading organism, or this means that this patient is immunocompromised, and if the patient is a known case of immunodeficient patient with severe complications from the start. Prevention of pneumonia and how to prevent pneumonia. It is very important to prevent pneumonia. The most important preventive tools available is using pneumococcal vaccine in those patients with chronic lung disease, chronic liver disease, splenectomy, diabetes mellitus, and extreme age population. Another way for prevention is washing hands, good hygiene, treat and control predisposing factors that increase the incidence of aspiration, and avoid contamination. Thank you so much.